Alberta Children's Hospital in Calgary is the only centre in Western Canada that offers an innovative surgical procedure to treat babies with hydrocephalus, which is a buildup of fluid in the brain.
Generally, they're babies, and they present either in utero or shortly after birth with enlarging heads. Parents will also notice the veins on the scalp are very bright and full. Their fontanelle, the soft spot, is full or bulging, and they're not accomplishing their milestones.
The minimally invasive procedure involves creating new channels for the cerebrospinal fluid to drain and circulate normally, and then eliminating some of the tissue that creates the excess fluid.
This is the lateral ventricle, so this is the third ventricle, and so you're making a hole. We're making the hole here. The chorial plexus we burn here, and then it's on the roof. So here's the floor. So we make a hole into the floor here, and the fluid can get from this space to this space. So this is after. You can still see the blockage there, but now there's a bypass, and you can see that the ventricles are smaller. The whole brain is tight, child is sick, the brain is now loose. This is what a normal brain should look like.
Standard practice is to place an internal shunt or tube to drain the fluid into the abdominal cavity, where it is reabsorbed by the body. However, infection is a common risk with shunts.
Until recently, 60% of shunts blocked in the first 2 years. And in a study showed that every patient had at least, in general, the average of about 4 procedures every 10 years. So they block, and every block requires surgery, hospital stay, time away from school, time away from jobs. Also, they get infected, and infection is our dreaded complication. You have to come in, have surgery, have your shunt removed, or the infection won't clear, antibiotics for 2 weeks, and then a second surgery to put it back.
Lauren and Jamie Plessy's daughter, Bea, developed an infection at birth that required 3 weeks of treatment in hospital before she could go home. 5 months later, a routine checkup revealed her skull was growing too rapidly. Because she was still under 24 months of age, Bea was a good candidate for the ETV-CPC procedure.
It made total sense to me, like the way the procedure was explained and what they do. The risk of long-term things happening was pretty much nothing. Whereas with a shunt, there's all sorts of, infections, and they got to lengthen it as she grows and all that kind of jazz, right?
Yeah, she's very social now. She's wants to do more stuff, so she's very interactive with people, interactive with toys now.
Yeah, we're super thankful.
We're very blessed.
Yeah.
Dr. Reva Cameron is one of only 2 neurosurgeons in Canada trained in the procedure. The University of Calgary and the Alberta Children's Hospital are currently taking part in many studies examining the effects of the procedure and further evaluating who will make the best candidates.